Daratumumab as a single agent is showing benefit in this high-risk smoldering myeloma population based on the Aquila trial. And now, in newly diagnosed myeloma, we use the regimen of daratumumab with Bortezomib, Lenalidomide, and Dexamethasone as one of the most commonly used frontline regimens. So can we improve depth of response in these high-risk smoldering myeloma patients and perhaps delay progression or prevent progression in these patients? So that was the intent of this study. It was a 2-year treatment program with a modified schedule of Daratumumab, RVd, to try to limit toxicity. And then this was driven by MRD. So patients that were MRD negative at those 2 years will come off trial and go on observation, and those that are positive will be randomized into 2 more years of Daratumumab and Lenalidomide or to observation. So it has a 2-part component. So we've presented this updated data at several of the meetings, but at this data cutoff, we've enrolled 45 patients, and this is a typical high-risk smoldering myeloma population where majority of patients met high-risk criteria either by the 2220 model or some of the other validated criteria. And so far, the response rates also look very good in this trial. We have an overall response rate of 98% and a complete response rate of over 60% in these patients. And some patients are now at that 2-year mark for their MRD assessment, and so far we've seen 65% of patients that are MRD negative at 10 to the minus 5 at that 2-year mark, and about 45% of patients at 10 to the minus 6 at that 2-year mark. So these numbers are improving over time. More and more patients are getting through that threshold. So we'll see if that MRD negativity is sustained in these patients, and part 2 is currently enrolling to see whether that randomization to observation versus more therapy will lead to any improvement in some of these outcomes.